Physicians have always had an important role in helping their communities find solutions to health problems. Violence is a health problem, and our job here is no different from our job with infectious diseases or cancer. We know about the problem, we know much about what to do about the problem, and we need to help. Physicians have played a key role in reshaping the nation's tobacco policies. Right now we are playing a key role in re-educating the public about nutrition and obesity. This is part of that same body of work. There are many ways for physicians to get involved. One is in the individual clinical encounter. If a physician encounters someone who they believe is at high risk for violence, they need to do something about that. Much more broadly, physicians are almost unequaled in their power as advocates when they speak in the public's interest. And physicians who see this as a problem that has policy solutions need to communicate that to policymakers, whether it's directly through letters to the editor. Physicians speak for their communities. There's a lot that physicians can do in the clinical encounter. They can screen for depression, that's been shown to work. They can screen for alcohol abuse, which is a risk factor for both interpersonal and self-directed violence. They can screen for domestic violence. And it's important to remember that we do those screens because sometimes they're positive. And when a screen comes positive, the physician needs to act, whether it's a matter of connecting a patient with resources, or in an extreme case of a psychiatric emergency, notifying mental health professionals or possibly even law enforcement if there's a need for an acute evaluation. There's a great deal that we can do. Now is absolutely the time for physicians to get involved. It's been remarkable since the 15th of December, literally, physicians have contacted me and colleagues, not to ask, is this the time, but simply to ask, what can I do? It's the best of all possible questions. And it's not just individual physicians. Organizations are stepping up. Institutions are stepping up. There has been and will be a raft of editorials in the nation's leading medical and public health journals. There have been positions adopted by the nation's leading healthcare and physicians organizations, the American College of Physicians, the California chapter of the American College of Emergency Physicians, the American Academy of Pediatrics, the American College of Surgeons. I could go on and on. Individuals and organizations are recognizing that now is the time. I think it's very important for physicians who, if not researchers themselves, are consumers of research information, to make a case that I think they can make uniquely well, that we need to collect the evidence on which sound policy is based, just as we need to collect the evidence on which the best possible medical care is based. So physicians in particular need to speak out strongly on the need for more research in this area, so that we can not only ask but answer the big questions that will help us make the changes that matter.